Welcome back. With families beginning to travel for the summer, many people are sitting long hours in the car or on a plane, and this can cause severe back and neck pain called suitcase spine. Who knew? And here to tell us about that is Dr. Dana Browning. And Dr. Browning, if you're anything like me, I definitely overpack my suitcases at points, but what are some different ways that we can pack differently to make sure that we don't get something like suitcase spine?
You want to pack less than 30 pounds of weight in your suitcase. Sometimes that's hard to do, but taking some of that out, maybe putting in a backpack where you can put both straps on your spine so you can evenly distribute the weight there. So there's some things you can probably take out of your suitcase that you can maybe put into a backpack that you can make this easier. Of course, having the rollers and all of these things are nice to take off the weight off the spine.
Okay, and then for people who are planning on taking those long road trips to see family, friends this summer, head to the beach, what are some different things you can do while you're sitting in the car for so long?
My advice first is always to stretch before you get on the road. So take some time to stretch and loosen the spine before you get in the car. You shouldn't really drive more than 2 hours at a time without taking a break and getting out of the car. Walk around, whether it's walking in to go get gas, go to the bathroom, any of those things, just walking around your car to loosen your spine so that it doesn't get stiff. I always suggest to my patients that they move the seat if they can, move it forward for a little bit while they drive backwards, using your lumbar support. All of those things are helpful. If you have a jacket or sweater you can put behind your lumbar spine for some support there, that's helpful.
Okay. Yeah, I'm kind of the type of person that tries to make it through as long as I can on a road trip, so you'll be in my mind next time I take a road trip. Yeah. And then what about a plane too? I feel like, I mean, some of these, especially if you're doing these international trips or something, you can be sitting down for 6-7 hours. I mean, what should they do on a plane?
So again, walking around the terminal before you get on the flight, making sure that you stretch. Same thing, jacket, sweater, or something behind your spine. Same thing with neck cushions. Sometimes the neck cushions they provide on the plane are not as good for your spine as they should be, so rolling something that gives you some support there is helpful.
Okay, and then say if we don't follow any of these tips, show us here what that could look like on our spine.
Sure, so as you sit and you don't move, your spine gets tight and there's a lot of strain, so if you're already prone to some injuries, your spine should look nice like this cushion here.
Okay.
And if there's a lot of undue pressure and strain in your spine, then the disc can start to bulge and possibly herniate or protrude. So that's not what we want. That's when pain comes in, and that's what we try to prevent in our clinic, is making sure that we can take the strain and the stress off traveling. I talk about this pretty much every day in my clinic right now, the things we can do to eliminate the stress and strain in your body while you travel. So we don't want these things to prolong and have possible disc injuries or back injuries.
Yeah, say if you did have something like this, how long would that take to recover from?
I mean, it can take weeks. It's not, usually this doesn't happen overnight. It's a lot of repetitive stress and strain, so it does take time to correct that as well. It's not always one-time shot and over with. We work on that to correct that and make sure the spine gets mobilized, and we put more flexibility and mobility in that joint space so that we can help you relieve your pain.
Okay, so even though you're excited about your vacations, all these drives in the car, flights on a plane, definitely something to think about.
Yes.
All right, thanks, Dr. Browning. Appreciate it.